Locked away in jail without ever committing a crime, without even being accused of a crime. This is a reality for hundreds of people in Mississippi every year. They are people who need mental health care, not imprisonment. And when there's not enough resources to help them, Mississippi's alternative is jail. In a handful of cases, people have died while waiting for help. Fox 13's health reporter Mandy Hrach investigates why this is happening and the changes that are underway.
For someone going through a mental health crisis, doctors say a stay in jail could set them back on their recovery and increase their risk of suicide. Even so, many people needing mental health treatment in Mississippi find themselves in a jail cell. But a new state law aims to change that.
Law enforcement kept coming to us saying, you've got to do something about mental health people in jail. We don't want them in our jails.
And yet, Mississippi put hundreds of mental health patients in jail each year. It was completely legal. The process called civil commitment. A court orders someone into mental health treatment, but when there's no room for them at a health facility, Mississippi's alternative was jail.
We never really intended for people to be in jail. And it's been going on for a while.
A problem State Representative Sam Creekmore is working to fix. Is there a need for more psychiatric beds in Mississippi?
Initially, I don't think there really is. I just think we're underutilizing what we have.
A bill Creekmore sponsored this year became law. It requires a mental evaluation from a health provider before the civil commitment process starts. If a judge deems it necessary, the patient can only be jailed if they are, quote, actively violent. And jail is only an option for a maximum of 24 hours. The law took effect in July, and the Mississippi Department of Mental Health says it's already making a difference.
In August of 23, there were 86 admissions, and in August of 24, there were 31 admissions.
Executive Director Wendy Bailey says there's been a 58% decrease in the number of mental health admissions that have come from jail to state hospitals. Mississippi has 320 psychiatric beds across 4 state-operated hospitals. In 2022, Bailey said the average wait for a bed was 9 days. Now that wait has been cut down to 4 days. And if someone is waiting in jail, Bailey said they typically wait less than a day.
We are hopeful that the changes with House Bill 1640 is going to enhance our mental health system in our state by improving access to services and the continuum of care for Mississippians with serious mental illness. But it does take everyone who has a part in the process working together.
While there is still progress to be made, Bailey wants people who are struggling with their mental health to know there is help. Oftentimes, care is provided without the need of civil commitment.
Reaching out for help is a sign of a strength, not a weakness. Knowing that it's okay to not always be okay, and if you need to talk to someone, that someone is there. I reached out to Baptist DeSoto, a private hospital, to ask how it handles mental health patients. A spokesperson sent me this quote in part: when crisis intervention certified officers encounter patients they believe are having a severe mental health issue, they can take these patients to our hospital for emergency medical treatment instead of the DeSoto County Detention Facility. It goes on to say, in accordance with the new law, we are prepared to keep these patients until they can be transferred to a facility that can treat their behavioral health issues, but the safest and best place for them is a behavioral health facility that specializes in treating their condition. You can read the full statement on our website, fox13memphis.com. Covering your health, Mandy Hrach, Fox 13 News.